Smart Heart Failure Revival Clinic, Remote Monitoring Dashboard, Mobile App and Home Care Medical Gadgets. This is a step-by-step guide for registering a patient in the Smart Heart Failure Revival Clinic. First, let's enter the website name, medcareroyal.medvantage.tech. When we enter into this, the login page will appear where we will use the username, medcareroyal.ae and the password. Now, this EMR appears here. Let's start with the home care registration of the patient. Enter all the required details like, there is a patient named, his mobile number is, his name is, his date of birth is, his address, etc. After entering these fields now, we will input where he is listed in the Smart Heart Failure Revival Clinic, along with doctor's name, and inform if in case it is home care. Then, we can save and print. A token will appear and one UHID will be there. This UHID will be further used for our dashboard. So, let's check with the dashboard. Let's click on our dashboard. And if we see patient's name, his UHID will also reflect. This UHID will be further be used in his mobile app where we put this UHID. The OTP will appear and then he can use his gadget integrated with the app, and from that app all the vitals will appear on this dashboard. We can see the dashboard in list view also. Smart Heart Failure Revival Clinic module. We can see the list of all patients with demographic details in Smart Heart Failure Revival Clinic under Home Care. A. Home Care Patient List. Home Care Patient Prescription. By clicking on Patient Profile option, which is located in Home Care Patient List, we can feed the symptoms, diagnosis and prescriptions. A doctor can also order investigations such as NT-proBNP, potassium, calcium, creatinine and other required investigations, and can view older investigations results. Vitals. Patient can connect the gadgets and get the vitals once in a day or once in 2 days or SOS. Patient Case Summary. In this section, the doctor can add case summary of the patient using mic. Recommended diet, food. In this section, the heart failure dietitian, nurse can assign the recommended diet, food. Intake and output. In this section, the patient can add her intake like water, juices or other fluids. Also, he can add the output. Investigation result. In this section, Smart Heart Failure nurse can add the report like NT-proBNP, potassium, calcium and creatinine, or it can be added by the patient. Now, in the earlier demonstration we register the patient Mr. Asif, whose UHID number is. When we type on the login page we will get an OTP because the right person is using this app or this UHID. If OTP is sent successfully, we continue. This is Vital Management. Now I click on the Vital Management, then Add by Machines. We are taking the BP. We click on the BP. Now see, this is the BP machine we are using and we have integrated this with our app. The machine is taking my BP. See, now BP is 114/77C, and when I save this the BP appears here. Asif Khan's BP appears here if you see in the dashboard. This is the real-time transfer of data there. Now we will go to other device, that is our pulse oximeter. See, this is the pulse oximeter. And, again I went to this app now to find SPO2. I click on CT oximeter and now it is connected. If you see the data you see the pulse rate and the SPO2. I save the data successfully. If you see on the dashboard 99 SPO2 is coming, so real-time transfer of data is here. Now we will go to another device, that is our ECG machine. This is our portable ECG machine and this is a sealed machine. If you see, this is the ECG option. I click on the start and where to keep these. There are points where we have to keep the color coding. We have to place there, and then to start the test, have to click the connect. When it is connected, you see this ECG is coming and now you can generate the report. You can generate the report and now you can send the report either on the dashboard or it can be directly shared to the WhatsApp or any media, whichever you want. So now these 3 devices can be connected for the pilot project to be started. After starting with these 3 devices, There is our wireless stethoscope that can be used if the doctor wants LS to listen to it live. When he clicks on this, it is started, it is connected and doctor can listen to it live on the dashboard.